Good morning, everyone. I'm excited to welcome you to today's session. Today, we'll be focusing on scenario-based multiple-choice questions for Prometric. This is the first slide, so I just want to give you a quick overview. We'll explore how scenario-based questions are structured, discuss strategies for tackling them, and look at some examples to help you prepare effectively. Let's get started. Let's take a closer look at this digoxin scenario, specifically focusing on a low heart rate. When we discuss MCQ explanations, it's essential to understand how digoxin affects the heart. Digoxin is known to increase the force of cardiac contractions, but it also has effects on the electrical conduction system. In cases where a patient develops a low heart rate, or bradycardia, it's often related to digoxin's action on the atrioventricular node. It can slow down conduction, which is beneficial in certain conditions like atrial fibrillation, but it can also lead to excessive slowing. So, when evaluating multiple-choice questions about digoxin and bradycardia, look for answers that highlight the drug's influence on heart rate and conduction pathways. Remember, the key is to balance the therapeutic effects with potential toxicity, especially when the heart rate drops too low. This slide underscores the importance of understanding the drug's mechanism, so we can make informed decisions when managing patients on digoxin, especially in scenarios where their heart rate becomes dangerously slow. Now, let's look at the options for how the nurse should respond when a patient on digoxin has a heart rate of 52 beats per minute. The options are to give the dose, hold the dose, increase fluids, or just document only. The correct action here is to hold the dose. This is because a heart rate this low could indicate that the digoxin is causing bradycardia, which can be dangerous. It's important to recognize that holding the medication temporarily allows us to assess the patient and prevent potential complications. Increasing fluids might be helpful in some situations, but in this case, the priority is to hold the medication until we evaluate the patient's condition further. Documenting the event is necessary, but it doesn't replace the need to hold the medication. So the key point here is that holding the dose when the heart rate is too low is the safest immediate action to prevent adverse effects. In this scenario, we see a patient on digoxin who has a heart rate of 52 beats per minute. As you can imagine, digoxin is used to help control heart rate and improve cardiac efficiency, but it requires careful monitoring. A heart rate of 52 BPM is considered bradycardic, which means it's lower than the normal range. This is a critical point because digoxin can cause or worsen bradycardia, especially if the dose is too high or if there are other contributing factors. So the correct response here is to hold the dose. That's because continuing digoxin at this point could lead to more severe bradycardia or other toxicity symptoms. It's always important to recognize these signs early and take appropriate action. This example highlights the importance of closely monitoring heart rate in patients on digoxin and understanding when to hold or adjust the medication. Managing medications like digoxin involves balancing their benefits with potential side effects, especially in patients who show signs of toxicity or adverse effects. Now, let's talk about why we need to hold the dose of digoxin in certain situations. Digoxin is a medication that slows the heart rate, which is helpful in many cases. However, if the heart rate drops below 60 beats per minute, we must hold the dose to prevent any complications. Giving digoxin when the heart rate is too low can lead to dangerous bradycardia, which means the heart is beating too slowly to pump blood effectively. So always check the patient's heart rate before administering digoxin, and if it's less than 60, hold the dose and reassess. This step is crucial to ensure patient safety and avoid potentially serious side effects. All right, at this point, if you notice that a patient's heart rate is too low or irregular after giving digoxin, the first step is to hold the dose. It's important to pause and prevent further medication from being administered until we evaluate the situation. Then, we should recheck the heart rate after a few minutes to see if it has stabilized or if it's still dangerously low. Next, it's crucial to assess the patient for signs of digoxin toxicity. Keep an eye out for symptoms like nausea, vision changes such as seeing halos or blurred vision, and dizziness or weakness. These signs can indicate that the medication level is too high and toxicity may be developing. If any of these signs are present, or if the heart rate remains dangerously low, don't delay. Notify the doctor immediately. They need to be informed promptly so they can decide on the best course of action, which might include adjusting the dose or providing specific treatments. Remember, monitoring heart rate and watching for toxicity signs are key components of safe digoxin administration, and quick communication with the healthcare team is essential for patient safety. Let's talk about the importance of checking the apical pulse before administering digoxin. It's essential to always take a full minute to assess the apical pulse because digoxin can affect heart rate and rhythm. If you find that the heart rate is less than 60 beats per minute, you should hold the medication. This is a critical safety step because giving digoxin to someone with a slow heart rate can lead to serious complications. Remember, always prioritize checking the pulse thoroughly and following the key point. Never administer digoxin if the HR is below 60. This practice helps ensure patient safety and effective medication management.